Hello, Namaskar, Sat Shri Akal, Salam Alaikum. Once again, your doctor, your own family physician, cardiologist, दिल का डॉक्टर आपके साथ डॉक्टर कपूर पेश करता हूँ। आज कुछ ऐसी चीज़ है जो हर फिजिशियन, हर डॉक्टर, हेल्थ काउंसलर आई एम श्योर ਤੁਹਾਨੂੰ ਐਡਵਾਈਸ ਕਰਦਾ ਹੋਗਾ ਬਈ ਐਕਸਰਸਾਈਜ਼ ਕੀਤਾ ਕਰੋ, ਹੈ ਨਾ, ਵਿਦ ਸਾਈਡ ਡਾਈਟ ਐਂਡ ਲਾਈਫਸਟਾਈਲ। ਐਕਸਰਸਾਈਜ਼ ਦੀ ਬੜੀ ਇੰਪੋਰਟੈਂਸ ਹੈ। ਯੈਸ, exercise is very very important. It gives rise to millions of good things to the life, to the health of a person. But ਹੁੰਦਾ ਕਿਵੇਂ ਕਿ ਆਦਮੀ ਜੋ ਹੈ, ਅੱਜ ਦਾ ਐਗਜ਼ਾਮਪਲ ਮੈਂ ਦਿੰਦਾ ਇਸ ਵਾਸਤੇ ਮੈਂ ਟੌਪਿਕ ਤੁਹਾਡੇ ਵਾਸਤੇ ਐਸ ਸਪੈਸੀਫਿਕ ਲਿਆਇਆ ਹਾਂ ਕਿ आज मेरे को एक बंदा आया, बड़ा हेल्दी लुकिंग, इन 50s 40s 5 46 47, mild cholesterol and otherwise no issue. All the time he's been very stressed and some smoking was going on. तो वो बड़ा हेल्थ कॉन्शियस है एंड ही वाज डूइंग लॉट ऑफ एक्सरसाइज। तो कहते साहब मैंने 2-3 महीने तो एक्सरसाइज करा विचों विच हार्ट विच ਇੱਥੇ ਹਾਰਟ ਵਿੱਚ ਮਸਲ, ਉਹ ਹਾਰਟ ਨਹੀਂ ਕਹਿ ਰਿਹਾ ਸੀ, ਕਹਿ ਰਿਹਾ ਸੀ ਮਸਲ ਵਿੱਚ ਪੇਨ ਹੁੰਦੀ ਸੀ, ਤੇ ਮੈਂ ਐਕਸਰਸਾਈਜ਼ ਹੋਰ ਵਧਾ ਦਿੱਤੀ ਤੇ ਮੈਨੂੰ 5-6-7 ਦਿਨਾਂ ਤੋਂ ਹੋਰ ਜ਼ਿਆਦਾ ਸੀਵੀਅਰ ਪੇਨ ਹੋ ਰਹੀ। Now this was going on his own. His health counseling was being managed by his own, but luckily he came today and I told him ki who advised to increase your exercise? This is what I have heard everywhere. I have read that exercise is good for the heart, at least. So I thought at least heart will be managed. Now this guy was lucky. At least he came before he would have dropped down on the treadmill or bicycling or treadmilling. We took him for angiogram. There was a clear-cut classical 90% block in one of his main arteries, which had to be opened up, and he couldn't believe, and still he was in denial till we opened up. I'm sure in the coming times we'll do his stress tests, ECG, all those tests will be done before we give him again a green signal to start actual exercise. तो मैं example इस वास्ते ਤੁਹਾਨੂੰ पेश किया है सब। I wanted to share कि after a certain age, if you're going for the exercise program, please don't go on your own. Take a physician or a cardiologist or your doctor's advice. It's very important. ਅਸੀਂ ਸੁਣਦੇ ਹਾਂ ਰੋਜ਼, ਸ਼ੇਨ ਵਾਨ ਦਾ ਕੇਸ ਸੁਣਿਆ ਹੋਏਗਾ, ਮਾਰਚ ਵਿੱਚ ਵਿਚਾਰਾ he had a heart attack and a cardiac arrest and he died. He was one of the best sportsmen we can think of, captain of Australian cricket team. Then a lot of actors we lost, but then Raju Srivastava, I remember he is from my city, from where I come in India. Oh, vichara exercise treadmill karde he had a cardiac arrest. He couldn't survive, unfortunately. We lost such a great stand-up comedian. And both are evidence. This is the examples you come across because of the celebrity status. But as a doctor, my life I have come across so many. Being a doctor for the FIFA medical examination in this part of this world, I came across many, because there are a lot of clubs, so we do all their checks, and even as young as 30, 28, 27, they all usually young players. We sometimes, maybe 1 in 100, we get a person that he is one candidate who will drop down while playing. And you must have heard a lot of athletes we lost when they are doing their aggressive game or a match is going on. So this has become a norm, at least for football I know, for which I do a lot of medicals and cardiology assessment before we give them the clearance. Now, it is not the exercise which kills them. It is a disease underlying in the heart already present. On the dil which arteries which blockages, heart the arteries on the blockage on the muscles the abnormality on the electrical system abnormal on that. Already they are harboring the disease. But when we overexert, that disease is precipitated in one fine day, we lose them. So these examples I have mentioned just to emphasize the fact that please, after the age of 30-35, you are planning to reduce your weight, bring down your obesity, bring down your blood pressure, bring down your cholesterol, prevent diabetes, prolong your life. Exercise is very good, absolutely no doubt about that. It's good doubt nahi, second thought nahi. But please take the advice, and there are simple tests for that. A simple ECG and a stress test on exercise ECG and echocardiogram, which all the cardiologists have in their office itself. Go to them. Tell your instructor that before doing exercise, I will get an evaluation done to make sure that I'm perfectly all right to do the exercise. and go ahead. Do as much as exercise after that. Then it is the doctor's responsibility. He'll take care of you. कभी कभी सानू बीमारियां मिलदियां ने एक्सरसाइज टेस्ट करते हैं सब करते हैं तो ऐसी वास्ते दी टेक अवे लेसन फॉर टुडेज इज दैट ऑल ऑफ अस हैव टू डू एक्सरसाइज to get the benefit. The benefits are not small. I mean, say benefits of exercise are that you bring down your blood pressure if you have hypertension. You bring down the risk of diabetes mellitus. If the diabetes is there, you get it treated to a great extent. Many of them, I stop the medications, I mean, this is how people say the diabetes is curable. Yes, if you do exercise, good diet, lifestyle, it's curable. You don't have diabetes, you don't have to take medication. You maintain your healthy body weight. You treat your metabolic issues, the tummy coming out and going for heart diseases. You bring down your heart issues. You bring down the blockage levels. You develop collaterals. So uncountable number of advantages are there. But we don't want to become Raju Srivastav like issue should not come. I am quoting him once again because we should understand that such a celebrity we can lose. And so many we have lost. So many top players we have lost. So other day I was watching a video in which ice hockey, the guy dropped down, but fortunately 999 was available and within minutes they were there. They did cardiopulmonary resuscitation. I will talk on CPR, BMR and all those topics so that every individual layman, housewife, worker, staff member, employees, all should be taught how to do simple BLS. Basic life supports to bring down a person who is dead to a normal living person. This has happened in our profession many times, but everybody could get a chance and he should learn BLS. So I'll take a different topic. So today's is that sports is important, exercise is important, but your heart is more important. You need to know how is your heart right now before you go in for exercise program. मेरे दोस्तों, बंधुओं, भाइयों, बहनों, सबसे ये गुजारिश है कि कोई भी हार्ट रिलेटेड एक्सरसाइज रिलेटेड कोई भी प्रोग्राम कर रहा हूँ तो ऑफकोर्स हमारे चैनल को सब्सक्राइब करिए. आप कोई भी इशू आए तो मेरे इस टेलीफोन नंबर में मेरी टीम से कांटेक्ट कीजिए. आई पर्सनली आंसर ऑल योर क्वेश्चन. आई एश्योर यू, मे गॉड ब्लेस यू विद गुड लॉन्ग लाइफ. कीप एक्सरसाइजिंग, keep discussing with all your health counselors how much and where and when to start your exercise. Thank you so much. May God bless. Namaskar.